Florence Nightingale, as you said, is considered to be the founder of modern nursing. She went to the Crimea War in the 1850s at a time when nursing was considered to be quite a menial and low status profession, and she made a phenomenal difference to the care of the sick and injured soldiers through the use of improved infection control, sanitation and statistics. She saved the lives of soldiers there. She established the traditional ways of doing things, and when she returned to the UK, she then set up the first Nightingale training school to educate nurses, which became a model for around the world. And today is the 200th anniversary of her birth.
And it means that there is intention now on nurses for today. We didn't really need a particular excuse to have to celebrate them after some of the quite incredible work that's been done over the last few months. Just explain to us, you represent nurses in various different countries, what the specific challenges that they're facing at this stage in the pandemic are.
So yeah, as well as being the 200th anniversary, it's the first ever World Health Organization designated Year of the Nurse and the Midwife in this global pandemic, which has put nursing in a spotlight like never before. We've been doing a few things. In the 24 hours leading up to today, we've actually been commemorating and remembering nurses who have died and other healthcare workers as a result of contracting coronavirus. They are doing incredible work to fight the virus, to support patients and their families, but often at risk to themselves. So we've taken a moment to do that. But today we are celebrating the phenomenal efforts of nursing right the way around the world. The theme that we set for today is nursing the world to health, and it couldn't be better in terms of what we see nurses in all countries doing. But we're also saying that today needs to be a clarion call for the future of nursing, for more investment, more resources and more support. We've gone into this pandemic 6 million nurses short worldwide. We've talked about, you've reported on the lack of personal protective equipment. In some countries, we've seen attacks, verbal and physical attacks on nurses as well. We need to fundamentally change the thinking around investment in nursing and health as well if we are to really nurse the world to health and improve health globally for everyone.
And we've talked about some of the problems in terms of equipment, but what about the mental health of these professionals who are going into deeply stressful situations, often, as you just mentioned there, not being able to see their own family and friends? What kind of support is there for nurses when it comes to looking after their mental health, and are they getting what they need?
The mental health support that nurses and other health workers need is as important as the physical work that they are doing. The intensity of the work, often they're stepping in and providing emotional support to patients because the families can't be there. The nurse may be the last hand that the dying patient touches or the face that they see. They're separated from their own families, as you said. We're having to experience more patients who are dying than normal as well. This could be a hidden issue as well, because it's not just about the impact now, but it's down the line, months down the line, where there could be post-traumatic issues as well. Nurses need to have support in terms of being able to talk about this, to be able to say, I'm not okay, not having to work endless shifts, but having breaks, making sure that they are able to, in a safe way, see their families as well. Because with this 6 million shortage, if we don't look after nurses' physical and mental health, the risk is that we exhaust them. And that will be a major issue if there's a second spike of this virus.